You've probably heard of sickle cell disease, right? But if you're not totally sure what it actually is, then you're in the right place. We're going to break down a condition that so many people know by name, but very few really understand.
And, it's so important that we do understand it because this disease quietly kills hundreds of thousands of people every single year, and most of them are children. The stakes here are just incredibly high. Okay, let's get into it.
So, what is actually happening inside the body to cause all this? Well, it all comes down to the science of our blood. At its core, sickle cell disease is a genetic blood disorder. It's all about our red blood cells, the little delivery drivers that carry oxygen to literally every part of your body. And the problem is, with this disease, those all-important cells, they just don't form the right way. And here's the crazy part. A whole lifetime of massive health problems all comes from one single microscopic change in one gene, the gene that's responsible for hemoglobin, which is the protein that, makes blood red and carries all that oxygen. It's wild. And this slide shows you the result of that tiny change perfectly. On the left, you've got your healthy red blood cells. See how they're soft, round, flexible? Kind of like little donuts. They're built to squeeze through even the tiniest blood vessels. But on the right, that's the problem. The sickled cells become hard, sticky, and they get bent into this banana or sickle shape. So this new shape, it causes two huge problems. First up is anemia. The sickled cells are fragile. They break down easily, so you just don't have enough healthy cells to get oxygen where it needs to go. And that leads to this constant draining fatigue and weakness. And second are the blockages. Those hard, sticky cells get jammed up in small blood vessels. It's like a traffic jam that cuts off blood flow, causing unbelievable pain and, over time, really serious organ damage. Okay, so that's what the disease does to the body. But how does someone get it in the first place? Well, that takes us to the genetics of it all. And here's the most important thing to know. You are born with it. Full stop. This isn't something you can catch like a cold or the flu. It's inherited. This chart here breaks it down super simply. If you look at that top row, if you get the sickle gene from just one parent, you have what's called sickle cell trait. You're a carrier, but you probably won't have any symptoms. But if you look at the bottom row, if you inherit that sickle gene from both of your parents, that's when you have sickle cell disease. Now, you might start to see a pattern here with where this disease is most common. It tends to be in people whose ancestors came from places where malaria was a huge problem. And here's this kind of cruel but fascinating evolutionary twist. It turns out that having just one copy of the gene, the sickle cell trait, actually gives you pretty good protection against malaria. So it was a survival advantage that kept the gene around in these populations for generations. But, the science is one thing. We have to talk about the human cost. What is it actually like to live with this day in and day out? For so many people, their whole life is defined by something called a pain crisis. These are these cycles of intense, completely unpredictable pain from those blood vessel blockages we talked about. We're talking pain so severe, it often means a trip to the hospital. And the danger goes way beyond just the pain. The disease can cause a whole cascade of really life-threatening problems. The constant damage can lead to severe infections and even strokes. And this is a huge one, especially in young children. There are dangerous lung problems, kidney damage. Over a lifetime, it can impact nearly every single organ in the body. And this is so important to remember. The toll isn't just physical. Imagine living with constant pain that no one can see. Imagine missing school or work, and sometimes even having doctors who don't believe how much pain you're in. It's no surprise it leads to really high rates of anxiety and depression. The emotional burden is just immense. And the consequences, especially when it's not diagnosed or treated properly, they're just devastating. Get this, in many countries in Africa, more than half of the children born with sickle cell disease die before they even reach their 5th birthday. But the story does not end there. And this is the hopeful part. We are fighting back, and we have an incredible, expanding arsenal of tools to do it, from simple prevention all the way to breakthrough therapies. And I want to be really clear about this. We have tools that are saving lives right now. This isn't some far-off dream. These are real solutions that are changing people's lives today. And you can really see that incredible progress here.
In the past, it was about simple but powerful things, like screening newborns and giving them daily penicillin to stop infections. Today, the standard of care includes things like a pill called hydroxyurea and regular blood transfusions. And now, we're on the cutting edge, looking at actual cures like bone marrow transplants and gene therapies. But this is where it gets complicated, and this chart really lays out the challenge we're facing. Look at the bar on the left. The cures, like gene therapy, they are revolutionary, but they are incredibly expensive, complex, and they come with risks. Now look at the bar on the right. The prevention stuff, screening, basic meds. It's super low cost and very low risk. So the crucial point is that while we are chasing those amazing future cures, we absolutely cannot forget about the life-saving power of simple, cheap prevention that we can use all over the world today.
So when you boil it all down, it's this. Sickle cell disease starts with a tiny genetic typo, but ends up impacting every single part of a person's life. By understanding the science, the genetics, and the very real human toll, we take the first and most important step toward changing that story for millions of people. Which really leaves us with one big, important question to think about. We have simple, effective tools that can stop kids from dying, and we have incredibly complex cures that can end the disease for good. So if we have the tools, what's stopping us from getting them to everyone who needs them?